Hello, everyone. Happy National Day of Civic Hacking. This is our 9th annual National Day of Civic Hacking. And whether it's your first or your 9th, we're so glad you are joining us. Coming together as a global community, we have almost 1,000 people registered for today, joining us from all over the country and all over the world. Believe it or not, we have folks from 49 states and 25 countries, all coming together to explore how we might reimagine 911 and emergency response in the United States. My name is Meredith Rosky, and I use she, her pronouns. I'm the Senior Director of the network at Code for America. For those who are new, Code for America is a national nonprofit that partners closely with governments and community organizations to use technology and the principles of technology, importantly, to help governments and community services work well for everyone, both locally, statewide, and nationally. As we get settled in, I have a few housekeeping items I want to mention for today. So the first is our code of conduct, which applies to all the spaces that we share together, including, and I would say especially today, where we're focused on topics of community and individual safety, support, and well-being. You can find the code of conduct on our website, and it's also linked in a station in Gathertown. There's a few pieces of it I particularly want to emphasize for today, as so many of us are coming in with different backgrounds and experiences. So the first is to create a safe and respectful environment for all participants. It's kind of number one today. Second is presume the value of others. Everyone's ideas, skills, contributions have value. And 3, don't assume everyone has the same context and encourage questions. I think these are really important as we've got people from all kinds of different backgrounds and experiences and skills who are joining us today. Please get in touch with any of today's hosts or email safespace@codeforamerica.org if you experience a code of conduct concern. And speaking of questions, we encourage them. As we get into the panel discussion, please ask questions. Use the Q&A button at the bottom of your screen to ask questions. And finally, this work and this issue requires a movement. Please share your experiences, your quotes, whatever moved you today on social media to help keep the energy going that we'll create here today. And you can use the hashtag National Day of Civic Hacking or hashtag Reimagine 911. All right, let's talk just quickly about what today is going to look like from an agenda perspective. So first, we're going to start with this panel discussion. We've got some truly incredible people here that I'm so excited to bring their perspectives into the room. And then after the panel discussion, we're going to move into time working on the actions that are available to you today. We'll have about an hour and a half of that, and then an afternoon break. And there's going to be an optional lunch and learn that'll take place here in the auditorium that you'll be able to access. Then work time on those actions resumes, and then we're going to close at 3 o'clock Pacific, 6 o'clock Eastern with some closing remarks and a survey. Please complete the survey. There's a chance to win some cool stuff. The feedback matters to us, and you'll also be able to express interest in joining this work going forward. All right, so let's really get into it. To help kick us off, we have a few words from our CEO, Amanda Renteria. Amanda has a wealth of experience in education and in public service. She served as Chief of Staff in the US Senate and Chief of Operations in the Department of Justice. And she's also run for office herself. She knows just how important it is to continually push to improve our systems of government. And personally, there's a lot of things I really appreciate about Amanda. She's such a visionary, and she takes the work of Code for America and the people we serve so seriously. And at the same time, she never loses sight of having fun. You can often find her creating and editing her own video to help pump up staff, or decorating her office with Parks and Rec paraphernalia to help kick off our annual volunteer conference. I think that's kind of the spirit of today and what today's about. After a year and a half of Zoom meetings, we're coming together to do some really serious work on an important topic, but also to have some fun together. And I hope our space today, Gathertown, reflects that. And I know that Amanda really reflects that. So Amanda, over to you for a couple words.
Thank you, Meredith. Amanda Renteria. I am the CEO of Code for America. I use pronouns she, her, hers. And I'm just excited to be here. This is the 9th annual National Day of Civic Hacking. And I want to start off by thanking all of you. And I'm grateful for all of you to be here on a Saturday, a year and a half into a pandemic, a year and a half into screen fatigue. But I've learned a lot about Gathertown platform that's pretty fun. And I'm hoping that it'll be a difference than using a Zoom meeting all the time. So I hope you enjoy that. It's also just a reminder of our ability to adapt and still come together like this. That gives me so much hope about how we can take care of each other and our communities when we stay optimistic, civically engaged. So thank you so much for being with us today. I also want to call out our team at Code for America and everyone involved in making the decision to take this on. When you think about our society, the current challenges we're in right now, fires, floods, hurricanes, challenging economic times, especially for low-income families, racial inequalities, mass incarceration, no matter what it is or who you are, there's a moment where the only thing you have to help is pressing 911. 3 numbers everyone in the country knows, perhaps even before you learn the full sequence. And how we as a society respond in those moments, how systems catch you in those moments, says a lot about our country's values and our shared humanity. As you all know, our theme for this year's event is Reimagining 911, which fits into Code for America's work to shrink the role and reach of the criminal legal system. And when we talk about systems change, we're often dealing with disjointed systems or a patchwork series of government services. But 911 is really interesting because it's used all across the country in every community, which means we have a really special opportunity for impact to imagine this system to be truly human-centered. And I also want to just put it plainly, we know that it hasn't been there for everyone in the same way. There are countless examples of 911 calls leading to armed law enforcement responses that may not be necessary and too often result in tragedy. Especially since last summer, so much of our conversation has been about how our emergency response systems that are meant to help people in crisis can do the exact opposite of that. So that's the first critical step, identifying the problem and lifting it up so we can all see it at a national scale. And then the question is, how do we fix it? How can we be part of that needed change? We're unique as a distributed national network to not just surface and message the problem, but to think through how the mindful use of technology can help address it. We're positioned to have a unique perspective on how we can reimagine the system to actually meet the needs of all of our communities. And what happens at that critical moment when you press 911 makes all the difference, especially in these volatile times. So hold on just one second. My system messed up. So today we're going to take a hard look at what systems of scale we have to meet people in crisis and what it will take to truly make that emergency response human-centered for everyone. Let me say that again. That 911 system, truly responsive and truly human-centered for everyone. That's the potential, and that's the work we're starting today. So Meredith, I'm handing it back over to you and our panel. I'm so excited to learn from all of you on this panel and really all of you in this conference. And I'm just so grateful for you dedicating your Saturday with us. And I hope everyone has a wonderful National Day of Civic Hacking. Thanks, Meredith.
Thank you, Amanda. We so appreciate your leadership, your vision, your energy. All right. For this panel discussion, I am so pumped because we have just an incredible amount of brainpower and experience here with us that we're so fortunate to have on a Saturday morning, early afternoon. So in alphabetical order, we have Professor Cesar McDowell. He's a professor of civic design at MIT, where he teaches civic and community engagement and the use of social technology to enhance both of those, which is just beautifully relevant to the group who's here today. Cesar, I'm so glad you're here with us. Can you tell us in one sentence or less why you're here today?
Well, thank you so much for having me here today. I'm really looking forward to this conversation. One of the things that brings me here is that we just established a new center at MIT called the Center for Constructive Communication, which is really dedicated to the issue of how do we build kind of the new communication systems, social media places that actually help us build more trust and actually be more constructive in our dialogue.
Incredible and so relevant. Next up, we have Chad Kazmar. He's the Deputy Chief of Police in Tucson, though his current role is Interim Director of Public Safety Communications Department, where he oversees 911 operations. Chad, thank you for joining us. Tell us what's bringing you here in one sentence or less.
Good morning, everyone. Chad Kazmar again. My pronouns are he, him. I'm here today with 21 years of public safety service under my belt and a representative of the emergency communications profession. I'm here because this is just such an uncharted territory with such a wealth of data that's really not completely understood. And curiosity is a key to learning. So I'm here to be curious, and I'm here to inspire you to be curious, and we're all here to learn, and I'm happy to contribute. So thank you.
I love that. I think curiosity is the theme for today. Thank you for lifting that up. Next up, we have Elena Fortuna. She's the Client Success Director at Code for America. She's also a former social worker and children's mental health clinician, where she worked alongside those dispatched to 911 calls. Hey, Elena, tell us, why are you here on a Saturday?
Hi, I'm so honored to be here. Thank you for inviting me. And I'm really grateful that everyone's here volunteering their time. So like Chad, I'm really excited to learn from all of you and to have this conversation today. I have 11 plus years of experience in different systems, child welfare and mental health and medical. And so I'm really excited to reimagine 911 and make sure that it's human-centered and that we improve as we go. So yeah, thank you so much for having me here.
Thank you, Elena. And finally, we have Rebecca Newstetter. Rebecca is the Principal Investigator and Executive Director of Transform 911, our partner in this work out of the University of Chicago Health Lab, where she focuses on reducing justice system contacts, disparities, and collateral consequences. Good morning, Rebecca. I think it's the morning for you. What brings you here today, and in one sentence or less?
Good morning, and good morning to everybody. Thank you so much for being here and sharing this space with us. I'm delighted, so thrilled to be here, and so thrilled at the interest in 911 and in reimagining this critical system that truly is life-saving in so many ways. But unfortunately, as Amanda described it, it doesn't provide that sort of life-saving support to everybody in the way that it should. It's a gateway to social services and to health and to the criminal justice system, yet we know virtually nothing about it. We don't know who controls the purse strings, what the governance structures look like. There's no real information or accountability on these systems. So I'm so delighted to have all of you here today to help us with this curiosity and learning to help understand the system better.
Great. I want us to start by understanding the current state of 911 and why there's some challenges associated with it, why we're even in a place where we need to reimagine it. So Rebecca, I'm going to toss it right back to you. Since you lead Transform 911, tell us kind of at a high level, what is 911 and why is transformation necessary?
Absolutely. Well, yeah, we think of 911 as this system that's been in place forever. And it wasn't introduced into the country until 1968. And it wasn't until 1999 that Congress actually mandated 911 as the universal communications hotline for all emergencies. But in that decision through 1968 and 1999, what we did is we created a 911 system that put fire, EMS, and police together and decided that there weren't other resources that were going to be ingrained in sort of the fabric of this system, recognizing that many of the problems that people were going to be calling 911 for wouldn't necessarily be resolved well by police and fire. Fire and EMS have some really clear rules of the road in terms of when they respond to what kinds of calls, or they're going to be well positioned to respond and to provide service and care to communities. And then literally everything else falls to the police. It's not a good or tenable situation for the police. It creates a lot of acrimony between police and communities and tension. And it's really horrible for communities who then have to make some really hard decisions when they or people in their community and family are in crisis, and they have to make a decision about whether or not to call 911 for fear that enforcement or use of force might be applied inappropriately. And so we really want to re-envision and understand this system better. And what we do know is that it's not just one system. There are about 6,000 different 911 centers, or what we call PSAPs, public safety answering points, which we hope you'll today help us learn more and explore about each of them across the country, because there aren't unified ways in which these systems are governed or how they're paid for. And most of the time, in most jurisdictions, people pick up the phone and they call 911 and they have no idea who they're calling, who's going to answer that on the other line, who's going to be deployed. And we want to help sort of take the mystery out of that and make sure that people understand how 911 works in their communities, and to develop some better systems and best practices in a space that has unfortunately been very uninvested in, particularly as it relates to the 911 telecommunicators themselves. It's an incredibly difficult job that they're doing with very little support.
Thank you, Rebecca, for kind of framing up this issue for us and grounding us in like why today is necessary and action today is necessary. I want to zoom in a little bit closer with you, Elena. Since you worked alongside those who were dispatched to 911 calls kind of in moments of crisis, can you tell us a little bit about what you experienced and how that informs what you think needs to be changed relative to the system?
Yeah, thank you, Meredith, and thank you, Rebecca and Amanda, for framing all of this. I've worked, like I said, in many different systems, so child welfare, medical, mental health, and alongside so many first responders, whether that be police or medical professionals. And I think for me, what I found the most frequently is that there was a re-traumatization through the systems of the folks that we were trying to help. And even though we had the best intentions, oftentimes, being in the field, when we got a call, there was so much uncertainty on the side as professionals. We weren't sure exactly what we were walking into, how we could help. And we have so much trauma as professionals walking in. And then also we have these trauma histories of our patients and clients that we're working with. And so it's not just the trauma that we're dealing with in the moment, it's also historical trauma and biases and institutional biases that we have. And so it was really clear to me that what we needed was collaboration across professional disciplines, because with that collaboration, then you have a shared language that you can really come in with, and you can support each other in those moments, as well as helping to regulate the person that is in trauma and in crisis. And so I think that as I moved through these different fields and through these different systems, I just kept seeing that there wasn't a ton of communication between professional systems.
I think that's so relevant because at Code for America, we often talk about being people-centered. I think everything you just described illustrates how at the ground level, the system is not necessarily currently set up to deliver that, no matter how kind of talented or experienced folks involved at any level of the system. Chad, for you, as interim head of a 911 department, you've also had a front row seat into the impact of our current 911 system on pretty much everyone, from folks who are calling to telecommunicators to responders. Why spend your Saturday pushing for kind of reform or reimagined system in something that you are in?
Yeah, great question. And Rebecca did a great job of framing the larger context of the role that the 911 system plays in the public safety team. But it's an interesting perspective of I had over 20 years of public safety experience before I was assigned as interim director. And what I can tell you is I have such a different appreciation and perspective now as a representative of such amazing and talented group of individuals. But like we've talked about, there's such a variety of ways that the systems work across the country, whether you're a large organization, whether you're small or you're mid-sized, can drastically change and impact your funding, your staffing, the technology that you're able to utilize. So from a public safety perspective, I'm here to create larger awareness that we are a key role. Emergency communications employees are a key part of the public safety team with police and fire services. And we're also now playing a larger critical role in triaging mental health calls and different types of community resources where we're hitting that pause button, and we're not just sending fire EMS or the catch-all police officer, but yet different services in the community. So we're playing a key role in being a local connector, and I'm just excited to be here today to be a national connector as well.
Thank you so much. Okay, so we've at this point explored some of the contours of this problem. I want to start to shift towards how we start to shape and kind of imagine and build on some solutions. So Cesar, your work is driven by deep commitment, in your words, to building beloved, just, and equitable communities. So in the context of 911, what's it going to take to achieve more just and equitable communities?
I think this is connected to not only what's happening in relationship to 911, but what's happening throughout our society. There's a fundamental issue of how do we build trust systems? right? Systems that actually continue to build and support and have people feel that those they're connecting with really are, in some sense, those that they can trust. And I think it's really interesting. I do want to say something even just about grounding the problem. We are in this space where it is not just the 911 system, but there are many systems in our society that we are now rethinking, right? We're reimagining, and we have to reimagine them because the fundamental principles by which they were initially built don't serve us anymore. And so one of the things we have to do is figure out what are the principles that actually need to undergird the new systems that we're putting in place. And I would say that one of the key ones, if we want to, really build a beloved and equitable community, is how do we build trust into systems so that people can figure out when I pick up the phone in 911 instance, maybe it won't be a phone for much longer, and ask for assistance. I know that assistance is going to come from somewhere or someone that I trust. And for many of our communities that are marginalized, trust is in people, it's not in systems, right? And so therefore we have to figure out, how do we make that possible, right? Are there new ways of thinking about connecting, even at the local level in the community, in a response that actually lets someone connect first with someone they know they trust or already have some trusted relationship with?
I think that point of trust is so critical because particularly for Black and Brown communities, other communities that have been marginalized by our current systems, that trust feels pretty far away, right? If you pick up the phone and call 911, that trust isn't there. So I think we can see how enormous the challenge is to get to that place of trust, but also how enormous the potential opportunity is to impact millions of people if we're able to design the system in a people-centered way. So kind of building up that, Rebecca, Transform 911 seeks to promote a more equitable emergency crisis response system, starting at 911, which is its earliest engagement point. What are you seeing as some of the levers to achieve that more equitable and kind of just system?
Yeah, well, I think it's really important just to point out that the 911 system as it's designed is inherently a blind spot. 911 telecommunicators, they answer the phone and they're hearing one person's perspective inside of the story, and they have to believe it to some level of truth. And they're doing this in, sort of lightning speed with a lot of pressure in terms of their own internal performance measurements, answering the phone quickly, trying to move on to the next call quickly. These call taking centers are under huge pressures because most of them are severely and critically understaffed. And so people are having to work mandatory overtime, double shifts as requirements, and they're not getting paid a lot of money to do that. And so there's all of this tension around trying to answer calls quickly and provide a response quickly while doing so with very limited and one-sided information. And that information continues to get sort of transmitted and kind of lost and changed along the process. I often describe the 911 system as the real life game of telephone, which many of us may remember this game from when we were children, right? Or even maybe you play it still and you whisper something in somebody's ear and it comes full circle and the information at the end is very, very different. And we have seen life-changing, tragic consequences as a result of that. And there are ways in which our own biases as systems and as human beings perpetuate that. The Tamir Rice case, which is really an awful but profound example of how the 911 system sort of cut information and made an awful fatal error. If you listen to the 911 audio of that call, you'll hear the caller at multiple points in time say, I think that this is probably a child. I think he uses the word juvenile. I think it's probably a toy. I think it's probably a gun. And sort of the speed and with the pressure that those telecommunicators are often under. What got entered into that 911 system for that call was that there was a Black man at a playground with a gun. That it was a very different reality than what we saw. And it didn't give the responding police officers the information that they needed in order to think about the skepticism and the likelihood that this might be a very different situation. And so what I would really love to see is that we design a system where we ensure that the right responder responds at the right time, that we understand our 911 systems in a way in which we are investing in them appropriately so that call takers aren't forced to get off the phone really quickly just to process the next call. It may very well be that a police officer isn't the best response, or an immediate lights and sirens response may not be the right response. But unless we have the resources and we understand how the structures actually work, we're going to continue to sort of rush to response, which creates the opportunity for harm. It doesn't allow us to understand what the fundamental underlying needs are, and creates all kinds of opportunities for inequitable and escalating responses.
Thank you so much, Rebecca, again, for kind of grounding us in the daily lived experience of the system all across the country, and also what some of the glimmers are for the path forward. On that theme, I want to toss it over to you, Chad, to tell us what is giving you hope that a reimagined 911 emergency response system is possible based on where you sit.
Well, I think it's conversations like today. It's increasing awareness not only in our communities but with our public safety partners. So many different things contribute to successful outcomes. For one thing, we have to talk about today is most emergency communications departments across the country measure success by how quickly we process a call. Most of us subscribe to NENA standards, which are the National Emergency Number Association, and we attempt 90% of the time to process incoming 911 calls in 15 seconds. Now, what you've heard today is most of our departments across the country are grossly understaffed. I have 47% of the staff that I should have to properly do my job. And what that means is I have staff that works 12 hours a day, 12-hour shifts. So they process those incoming 911 calls, which, again, I'll remind everybody, nobody calls to tell us they're having a good day. And so there's compassion fatigue. There's all these contributing factors. So as Cesar said, we have to be realistic. Our staff, emergency communication workers, they want to have that connection. They want to solve our community's problems and connect them with the right resources, but they're also under extreme pressure to manage the next call coming in. And so those are competing interests that we have to better recognize. And, my challenge to the coders today is let's really understand that. Let's dive into that incoming 911 call and how fast we're processing that. Nationally, we try to average about 2.5 minutes per call. Well, we're lucky here in Tucson where we have great community partners, and we're in the beginning stages of handing many calls, over 2,000 calls a month to mental health professionals, but we can be on those calls for 10 and 15 minutes. So as you can see, those are competing interests that we have to manage every day.
Yeah, I think that's such a good point. At Code for America, we often emphasize the importance of measuring the right thing, and that's deeply connected to centering people. And we can see here in the examples that you just provided that we have our goals and metrics for the system kind of upside down. Elena, I want to ask you a similar question. What is giving you hope based on the experiences you had on the ground related to the system?
Yeah, thank you, Meredith. I really love what Chad and Cesar and Rebecca have been saying. And I think that for me, it really starts with listening and paying attention to the stories that the communities are saying. But in addition to that, what our staff are saying, what our staff stories are, what they're experiencing themselves. As Chad was saying, there's this compassion fatigue, there's vicarious trauma that they're experiencing. And I think that really impacts the way that you can respond in the moment, because you have to make these decisions. For myself, as being an emergency response worker in the child welfare system in San Francisco and Alameda County, I would respond with police on site, and it's already an escalated situation. We aren't sure what we're going to expect. And then we have this, I think in these situations, oftentimes, it's really difficult for us to regulate ourselves and then co-regulate together. And so I think, again, kind of what Cesar and Chad are saying, like funding, having more funding for training, specifically trauma-informed training, really having an understanding. I think in small counties like San Francisco, a lot of the police officers, that would be their beat, the neighborhood that I would be going into. And so they knew families by name. And I think I wish that I had more training with the police officers so that we both could come in really being able to support and think about our specific roles in that moment and what we were doing. So I think a lot of it for me is, using technology to amplify these stories, to have a platform to really, really support and hone in on what our communities need and what our professionals need in order to be effective.
I'm so glad you mentioned the importance of amplifying people's stories. I know that's something Rebecca's team is working on, developing a people's history of 911 from all sides. Cesar, I saw you unmute, so I want to toss it over to you to kind of build on the conversation.
Oh, well, it's just the whole thing of a system to kind of really connect these lived experiences. And Rebecca will have to catch up sometime because we've actually built this really powerful system that actually what we're calling Local Voices Network that can really be supportive of what you're doing. But the other thing I wanted to say, I want to just add two other points. One is a little contrarian. And the contrarian view for me is I really don't like to use the term human-centered design because I think it's too generic. And I think our problems are much more political and structural and institutional. And so therefore, we need to really be designing for people who are most marginalized by the system we have. Because if you work with them first and understand the way the system has failed them, then you actually really know what the pain points are that you actually really need to really design around. And folks who are in the middle will find their way in, right? They'll get there. But if you continually not do that and really pay attention to those who are marginalized, they'll continue to be, no matter how much we redesign the system. So just another point I want to make in there.
Thank you so much for offering that, Cesar. And you're absolutely right. I think we need to evolve our language, right, as our understanding of how these systems change and don't change needs to change, especially for those of us in the field of civic technology who are trying to apply some of these principles to figure out how can we bring our skills to bear on some of these systemic challenges. Cesar, I want to go back to you because we've got a pretty geographically diverse group here. This issue is of course nationally relevant, as there's hundreds of millions of calls nationally going into 911 every year and locally managed. So you've written about the importance of valuing local knowledge, particularly for poor and disenfranchised communities and people. So as we work together to explore what's possible in this system, what role do you think that local knowledge and kind of practice-based knowledge plays in that effort?
Well, as many have said before, it's essential, right? Because if people on the ground, and this is kind of one of the problems we have, is that we have really two different knowledge systems. We have the knowledge system that's out there from what we can understand from statistics and numbers and other things, quantitative information that we get. And then we have the knowledge from lived experience. And we don't actually have a way to lift that and put those two things in relationship to each other. So the core of this thing of understanding local knowledge and really capturing those stories really allows us to really understand what the challenges are that have to be met. Because if you understand people's lived experience, how they live something, then you can begin to think about, okay, then what do we need to do to correct? And you've heard some of those stories, right? Chad talked about, how folks are overworked in some sense. Well, that is one way, but you have to juxtapose all the different narratives and stories that people are living with us and think about how do you design something and work with them, how do you design something that's really going to connect across all of that. So it's essential. I think if we don't have center people's lived experiences as a way of understanding the system and adjusting it and reimagining it, then we won't get there.
Yeah. And, there's a saying that those closest to the problem are often closest to the solution. I think that's what you're lifting up. And within this system, there are millions of people who have lived experience with it, kind of on all sides. And those are the voices we need to be centering and understanding as we understand the problem and the solutions. I want to pivot to questions from all of you. So I'm seeing some excellent ones here in the Q&A. If you have a question for our panelists, please use that Q&A feature. We'll get to as many of those as we can. There's one here that I want to toss to you, Rebecca, really relevant to some of the work your team is leading. Let's see if I can find it here. Does it make sense to think about alternatives to 911 as opposed to ways to improve 911? How do you respond to that?
Yeah, that's a great question. And I think it's a really complicated answer because a lot of the challenges that we have today in terms of our 911 system aren't because there's a sort of lack of professionals who are doing a good job. There are people who are doing amazing jobs in this role. The problem is that it's a very sort of neglected area in terms of resources and attention. And so my overall concern about creating sort of alternative hotlines is, does it further take away from a system that is already really neglected and in need of resources and attention? If we have, you know, a fully funded 911 system that's working in the ways in which the staff, the personnel are being well taken care of, they have the training and the supports that they need, that they have the professional recognition and the pay that they deserve, while at the same time we're able to process the calls of community members, then I think we're actually in a very different situation than we are today. I think that part of the reason why, if not the sort of main reason why people are looking to alternatives to 911, is because we have this situation in which so many calls default to the police, and we have a system that isn't working well because of a lack of investment and funding. So, I mean, my sort of design preference is to try to get right and make sure that we have the technology and the support to make this system that is by far one of, if not the largest civic engagement tool that we have at our nation's disposal. Over 240 million times it's being used every single year. In every single year. That's more than how many people vote by far, right? It's a very, very utilized system, but it's neglected in many ways. But I do not believe that there should be any wrong door. We have 988 that's being introduced, mandated by Congress the middle of next summer. Many jurisdictions have 211 systems, 311 systems. There should be all kinds of opportunities and ways in which people seek the care and the well-being that they need.
Cesar, again, I saw you on mute, so I want to toss it over to you for any reactions to that or different perspectives.
Maybe a little bit of a different perspective, because I think one of the things I really appreciate what Rebecca is saying, and the need to make sure that this system is really staffed and funded to the extent it, for what it needs to be. But I think the other side of this is we have very little evidence that fully funded public institutions actually equally distribute, their care and what they need to do. And so I think the issue of the fully funding is a good thing, but I think it may not get us to the place where we're realizing that actually there's still a lot of other issues inside the system. And all of our systems that continue to give us with unequitable outcomes, right? And so I think we have to also look at that question: is that how do we deal with that issue, and what do we need to put in place so these issues of inequality, as they manifest in our systems, aren't continually to be there?
Good point. Chad, take it away.
And I'll give just a third little perspective. So as a director who's trying to increase awareness in my community within the public safety profession, my home department, sometimes my worst customer, and demanding of immediate changes of services, where now I'm in a position to say no to, which has been interesting. But really, I would challenge the group to change from saying fully funded to appropriately funded. And what I'll share with both Cesar and Rebecca is I spend a lot of time right now fighting for necessary funding. My staff doesn't have, we're a major metropolitan city. We process over 500,000 911 calls. I'm the largest PSAP in Southern Arizona, and I don't have a legitimate training space that gives new hire call takers, specialist one, we call them, that gives them the environment that they're actually going to work in. That is 100% unacceptable in 2021. And so that's a good example of where, as we dissect this conversation, we have to recognize that, yes, I'm 100% in agreement with Cesar. Funding is a small part, but our staff has to be fairly paid. We're paying, when I first got here, we were paying entry-level call takers $15 an hour when officers are starting at, in the mid mid to high 20s. That's unacceptable. For somebody who's going to play a pivotal role in triaging these calls in an environment, and I put it in the call thread, what's success look like? You know, really, that's the other problem with this profession is as communities all have different measures of what that looks like. And so we certainly need to identify that as well.
I'm so glad we're on this thread of resourcing, because that's part of what today's exploration is about, particularly in our open data action, is understanding where it exists, where there's publicly available information about budgets for public service answering points, which receive calls into 911. And as I understand it from Rebecca, there's never been kind of a national investigation into the resources and where those resources go. And that's one role that this community can play, is using some of the investigation and data skills that we have to start to uncover these resourcing questions and figure out where there's opportunities there as well. I also love when we can like bring different views to this issue, because it's so complex. That's exactly what it's going to take for us to unpack what's possible. There's a good question here from James that says, are there elements of the existing 911 system design that should not be transformed? So I read into that, like, are there pieces that are really working? Elena, I want to invite you to weigh in on this question first, if you have thoughts based on some of your firsthand experiences.
Yeah, I think that for me, having worked, I think specifically what the memory that's coming to mind is in Alameda County, there's a program called SEED, it's Services to Enhance Early Development, and it's a multidisciplinary team that supports the individual who's in the child welfare system. And so I've been thinking a lot about when there was an emergency for that family in that situation. They had so many different professionals that they already had relationships with. They'd already built rapport with those folks. And so they were able to call any of us, whether that be the child welfare worker, the mental health clinician, their public health nurse, or their parent advocate. So they really had a lot of people in their corner already. And so it brings to mind just this idea of creating a model and maybe a training curriculum that's more comprehensive for everyone across states, but then really trying to narrow it into smaller communities. And to what Cesar was saying, really having a narrative from those communities of what they need, getting them involved, empowering them to be involved as responders. And I think it's really important to have community responders as well be a part of that model, which I have seen in different areas that I've worked. Where the community came out and they actually supported. They were like, hey, like when we were having to do a removal, we can take this child into our home. That was amazing. Then as a child welfare worker, in that moment of making a difficult decision and assessing the safety and risk of everybody, I was able to utilize the resources that we had right there in the community. So I think, again, it's like bringing it back to the community and having that drive the solutions that we're making.
We have lots of questions, so no pressure, but I want to invite anyone else to chime in on that one in particular, if there's elements of the system that should not be transformed, or maybe said differently, elements that we would want to be sure to keep in place or build upon in a reimagined system.
Well, one thing that I'll add is, a lot of this conversation has been about people who are most proximate to the problem, knowing most closely what the solution is that's going to solve the underlying needs. And what's been really inspiring to me as I've listened to 911 calls across the country from different call centers, including in Tucson, so that if you listen to the calls, people are often pretty clear about what they think they need. It's often really expressed in quite clear terms and in the conversations themselves. And so I think to the extent that we can sort of harvest the knowledge, the desires, the requests, the demands that are coming in through the calls themselves, in order to sort of understand beyond sort of our rigid coding systems of where does this call fit into and how does it best be resolved within a very sort of limited number of options that are available to us. And that's one of the things that's really exciting to me about this opportunity to reimagine, is to reimagine what is it that people need. And the challenge is that we don't know a lot about 911. We have, some statistics about, as I mentioned, at least 240 million calls coming in to 911 every single year. We don't know what people are most likely to be calling for. We don't know whether or not those calls are coming from the same people all of the same times. We know that some people will never call 911 no matter what kind of danger and threat that they are faced with because of the challenges, as Cesar and others have mentioned, around trust and legitimacy of systems. And so, we've invested nationally in trying to sort of understand things when it comes to labor statistics or criminal justice, but this is an area in which we really don't know very much other than what people are telling us. And that's some jurisdictions that have been very sort of free and open with their data, and we will hope to sort of harvest that and learn more from it today. But really trying to sort of understand from the everyday human beings who, when they're calling 911, they're calling because they trust us enough to ask for help when they need it. And we need to listen to them and trust that they know what they need, and to figure out ways in order to deploy resources that align with their expressed desires.
Lana, go for it.
Oh, I just love what Rebecca just said. And I just wanted to add in my field, what we always say when we're being trained is that the individual that we're working with is the expert on their situation. We come in with curiosity, we come in asking questions and figuring out the resources to support them, but they are the ones that, like Rebecca said, they know what they need. And it's just supporting them and in finding that and making a solution.
Yes, I'm sorry.
No, I was going to go to you next. So
okay, now I was just thinking, in the other part of my life, I do a lot of work around kind of community organizing and working on the ground with different kinds of communities. I think the adage that people know what they need is somewhat true. People are a lot more complex to that. What they know is what is actually available to them that they already have awareness of, which may be very different than what they need. And when they find out that there's something else out there, they may realize that's what they really need. So I think we have to be careful about putting these generalizations out there like that, because I think that's what gets us in trouble down the road, that we're not being specific enough about the conditions that people live in, who humans are, how they react within in a moment of crisis or need is very different than when they are in a different situation. So yes, they know in the moment what they need. I'm not trying to disparage and say people don't know anything. That's not my point. My point is that it's a lot more nuanced than that, and we should be very careful about what pieces of knowledge we build a system on. Yeah.
Want to quickly reflect and then go over to you, Chad, that I think, Cesar, I'm really glad you lifted that up, because there's so many things that go into understanding what is available to you, as you said, and I think our privilege is very much associated with that. Economic privilege, racial privilege of all kinds, sort of understanding, those options available, and therefore what you express that you need. So thank you for offering that, Chad. Yeah, go for it.
Yeah, I just want to applaud Cesar's last comment and build on that, and also say these systems take time to evaluate, to charter paths for growth and change. And one of the ways that the best way to affect change is, to hire a workforce that mirrors our community, because those are people who have grown up. They're going to come in with life experiences and skills and different things that make a special workforce that delivers the service that we want, independent of what the department's providing to them, because they can relate and they can connect. And that was one of our big cries as a leadership team when I got down here, and moving a significant pay raise that now reflects, you can start now in my community with a high school degree education and make the median income. That's a big deal, because now we can target high schools for folks who aren't going to go to college, and it's such a wealth of learning just from the employees, not from the department or the community.
It's such a good discussion. I'm so glad all of you are here with us on a Saturday. So we're going to take a couple more questions and then move in to giving all of our attendees here an overview of the actions that are available to you to participate in today relative to this topic. There's so many good questions in the Q&A that I want to invite any of our panelists. If you want to type a quick answer to those, please do. Please know that we're also, this work does not stop here. Today is a starting point, and we're going to continue this work in the coming months. So we will capture these questions. We will work to answer as many of them as we can, even if we can't answer all of them today. All right, there's one or two more I want to be sure to vocalize here. It's a good question from Rebecca that I think is really relevant to today's work, which is, can someone talk more about the difference in how 911 systems are run across the country? Is there national oversight? How well positioned are we to make shifts and changes nationwide versus at a local level? I think that is the crux of what we're grappling with. So I want to invite anyone who feels compelled to address that one to chime in.
I'm happy to chime in and chat, and Cesar and Elena, please do. And there's a wealth of knowledge in the chat. So we invite people also to sort of share their experiences and knowledge. But from what I understand, there's not a national model. We do have some national standards as it comes to call taking and call practices, but nothing that has been formalized and adopted across the board. And also, to my knowledge, there isn't an understanding of which jurisdictions have these in place and which don't. And similarly, there are all kinds of governance models. Chad, as he's described, is working in a city, a municipal 911 call center that's a separate agency, and it serves many police departments and fire and EMS agencies as the 911 communication center, whereas there are lots of examples across the country in which the 911 center sits directly within a sheriff's department or a police department or a fire department. And so what we know is that there are thousands of these across the country. Some of them are government agencies, some of them are nonprofit agencies, some of them are regional authorities, and some of them are in fact private for-profit entities that are contracted to perform these responsibilities. But what we don't know is what the proportion of these models are, or necessarily what's in place where, to my knowledge and understanding. But we have, some terrific resources in terms of the PSAP maps. We know sort of where the boundaries are drawn, which PSAPs exist in which places, and then we can make some generalizations. And I think that we'll be trying to do that today in terms of where they fit in terms of other kinds of governance structures, cities, counties, and things of that nature.
Thank you, Rebecca. All right, we have time for probably one or two more. I want to invite any of the panelists, if there's a question you're seeing in the chat that you really want to answer, I want to give you the floor to take it on.
One thing I want to share, because we participated with the Transform 911 yesterday and again today, and I'm tracking the thread. And the cool part for me, from living through the murder of George Floyd and then our own crisis here in Tucson, is we're fortunate in that when things go wrong in our community, we have a Sentinel Event Review Board. So part of learning is obviously critically evaluating when you don't have the outcome that you want. And I'm proud to say that our emergency communications department personnel participate with that review, because we evaluate the whole system when something doesn't go right, because it typically involves police, fire, EMS, and communications. But we also involve the community. We involve subject matter experts, folks from the mental health field, folks from medical professionals, anybody who has we focus on and include community members that can also provide perspectives and life experiences. So, really, when we talk about evaluating our 911, as Bonnie said it, we're a little like police in the profession in that, as Bonnie said, it's not the wild, wild west. Most of us are managed by EMD structure, cards, or ECBD. So there, in the absence of unified structure across the country, because all of our communities are different and expect a little different service, that structure has been created. I would probably put fire in the best position to have the most structure, followed by police, followed by emergency communications departments. But I want to challenge all of our emergency communications personnel not to take this as critical conversation about what we're not doing right, but an opportunity for growth. And anybody who's identifies as a professional, whether it's our personal life or our work life, we should be excited about that and embrace that opportunity to grow and learn and provide the best service possible to our communities.
All right, it's about time to bring us home. I will again mention there's amazing questions here in the Q&A. We're going to capture those and see if we can get some answers to those for all of you in the coming days and weeks, because this work is just a starting point. So as we close this out, I want to go to each of our panelists. Give us a word or a phrase in terms of a recommendation that you may have for the group today, as they're going to spend the next few hours exploring the different facets of this problem and the opportunity. Elena, I want to put you on the spot and invite you to go first.
Sure, yeah. I just want to thank again all the panelists and everybody volunteering. I think that for me, like all of you are, and all of us here are the force behind this vision and making it happen. And so just really inviting you to bring all of your ideas and challenge each other, ask each other questions, and bring in your own experiences, because I think that that is building trust across fields, across disciplines, across professions. That's what's really going to make the change. And so, yeah, thank you all for being here.
Thank you. Rebecca, what word or phrase comes to mind for folks today?
Just immense gratitude and encouragement for curiosity. Thank you so much for being here. I'm really excited for this dialogue, and thanks to the panelists and Code for America for taking on this work.
Great. Chad, same question for you.
Every time I participate in a conversation like this, I learn. So thank you to all of the panel. Thank you to everybody who's taken time to sign in today. I continue to learn. Continue to challenge everybody to be active listeners. That's the way we grow, to genuinely listen to other perspectives. It just makes us better human beings. So have a great day.
Thank you. Thank you. Cesar, going to give you the last word.
Well, I just want to also say just thanks to everyone on the panel. I learned quite a lot today, and I really appreciate it. I guess my last words were, don't reimagine 9/11, 9/11 instead, imagine something new, and do it from the standpoint of designing for the margins.
Thank you so much. All right, please join me in giving all of your gratitude to the panelists in whatever way it feels appropriate to. Thank you so much for being here. This was such a rich discussion. We appreciate you. We appreciate your experience, your conversation, your time today on a Saturday. So where we're going to go next is I'm going to spend about 5 minutes giving a high-level overview of the different actions available for you today. And then after that, you're going to have time to go explore those in various activity rooms that are set up within the Gather Town space. So I want to invite folks to screen to exactly. Thank you so much. Okay, so the first action, so we'll have 3 main categories of actions. They are open data, data analysis, and prototyping. And we'll have some different options within each of those categories. So that's what I'm going to explain here. So first is open data. This action is aimed at helping us to understand the problem. We know we can't start to build solutions until we have an understanding of the problem and the potential opportunities across 6,000 different jurisdictions, as Rebecca has mentioned. And understanding the different facets of 911 data, budget data across all 6,000 jurisdictions is something no one's ever attempted before. So that is a unique role that our community can play in helping to understand where there's potential levers for change. This is also the area where we need the most help. 6,000 is a pretty large number. And it's also the most accessible to all skill levels. So if you have a computer and you can Google, this action can be for you. So starting today and over the next few months, we hope to get to all 6,000 of those jurisdictions. So if you need somewhere to start, would recommend that you start here, and there's a specific activity room for this. And please keep in mind that you may find several piece apps in a row that don't have data available, and that's okay, and that's important information. So you'll fill out a scorecard that lets us know that, and then feel free to grab another one. Okay, next one. This is the first of our data analysis options, and so this is data queries. This is a really great fit for people who are analysts, database lovers, spreadsheets. We need your help here. So what you'll do here is work with Transform 911 experts to figure out how 911 data can answer important questions for us. The second category in our data analysis, go to the next slide, is data visualization. So this is for folks who identify as techies, information lovers, anyone who wants to turn kind of raw data into compelling visual aids. We need mechanism to help present this problem to different kinds of audiences, and this data visualization is a key piece of that. So you're going to use plugins to create graphs, dashboards, visualizations that help this data kind of speak to us. You should know that folks in the data analysis room will likely need a data.world account, which you're going to be prompted to do once you enter that room. And there will be specific guidance for you on how to do that. All right, and then our third category is prototyping. The first action available here is case studies. So many of you had questions about what are alternatives to 911? How might we learn from those? That's exactly what this is going to be exploring. So folks who identify as writers, as activists, folks who are infinitely curious about new possibilities should think about this action. So you're going to dig into a program that is proposing alternative solutions to 911 and start to look at what you can find about it, how it started, and how it might give us information for doing something similar elsewhere. Okay, next up in prototyping is what we are calling the Technologist Grab Bag. So you should join this if you identify as a coder, a designer, a self-starter, but probably most importantly, if you are someone who's okay with ambiguity and being pretty self-directed. So in this action, you're going to explore some kind of greenfield problem statements. And this is for folks who are kind of anxious to start something from scratch and see where it goes. And this may be kind of your traditional idea of prototyping, and you may end up with a wireframe of some kind or a lo-fi mock-up. So you're going to explore some of these problem statements and see what you can do with it. And there'll be more guidance in that particular room. So I'll mention again that each activity has an activity room, and there's going to be both explainer videos as well as written instructions for every action. And so your task in the next 10 or 15 minutes is to start to find one that speaks to you, make a friend or two if you'd like to work with someone else, and start to dive in. So on that note, I want to give you a couple final reminders for the day. These reminders spell out action, so hopefully you can remember this acronym. The first is A for accessibility. So as I've kind of alluded to, there's lots of support resources to you available today, both in the forms of explainer videos, videos on how to use GatherTown. If this is new for you, written FAQs on the 911 system. There's also a help desk. So there's also facilitators in each room who can help you. So no matter your learning style, we hope to have you covered in terms of resources available to you. C is for code of conduct. Again, please be kind and respectful. If you have a code of conduct issue, please report that to event organizers. Anyone with a star next to their name in GatherTown and wearing all green is someone who's an event organizer and can help you out. All right, T is for, I saw someone is commenting on my math skills. You're right, there's 6 things for you to remember today. Thank you. T is for tenacity. So we know there's going to be a learning curve, whether that's with GatherTown itself, or maybe this issue as a whole, or maybe the actions themselves. So would it really encourage you to be a little tenacious today, stick with it, get over that hump of like, oh, I'm not sure what to do or how to get started. We think that's possible with the community that we have here and with the resources available. And we know we learn most about ourselves and the system when we try new things and see what we can find. Fourth is inclusion. So please join others, invite others to join you, set a goal to meet someone new. You'll likely be glad you did by the end of the day. O is for organizers. Organizers can help. So again, folks wearing green with a star next to their name, or go to the help desk. People can help you out. And finally, N, our 6th word for the day, no one left behind. If you are really struggling with GatherTown, or it's not accessible to you, there's sort of an emergency email, and that's gather@amsl.com. Or you can join us in the Code for America Slack, National Day of Civic Hacking Slack channel, and we can help you out there. So remember our acronym for today, action. We've got about an hour and a half to start to understand these actions available to you and get to work, meet some new people. And then there'll be an optional lunch and learn back here in the auditorium later on. And then we'll go back to working on these actions together. And then we'll close with some closing remarks and a request for you to please complete the survey, enter to win some cool swag, and sign up to stay involved if you would like to. And that'll happen at 3 p.m. Pacific and 6 p.m. Eastern. All right, final words are so much appreciation to all of you. Thank you to our panelists. There's so much energy. I can feel that today, and so much experience. Thank you to all of the event organizers. So much goes in behind the scenes to pulling off events like this. So thank you to everyone involved in that. Remember our acronyms, actions, and thank you all. See you soon. Happy 9th Annual National Day of Civic Hacking. I hope you have a wonderful day, and we will see you shortly.